Picture, if you will, dominoes lined up. If you knock over the first dominoes and the other dominoes are closely behind it, the rest will fall in succession. However, if you take some of those dominoes out of the line or you space them further apart and then knock over the first domino, the rest of the line does not fall because there isn't another domino to contact. So think of that as some of the dominoes stayed at home. Or if the next domino is too far away to be knocked over, think of that as social distancing. We must continue to follow the data, which will help inform how we continue to move forward and get to our new normal. We can't undo all that we've done. We are going forward. We want to get into phase 3 and then beyond. We will be all. Voy a empezar con el reporte médico de hoy. Desde ayer estamos reportando 1,545 individuos adicionales con COVID-19. Ahora tenemos 98,030 casos totales confirmados en Illinois. Desafortunadamente, esto incluye 146 personas adicionales con COVID-19 que han muerto, para un total de 4,379 muertes. 18,443 pruebas hechas fueron reportadas en las últimas 24 horas. 8% de esas pruebas fue positivas. Hasta anoche se informó que 4,002 personas en Illinois fueron hospitalizadas y de ellos 993 personas estaban en la unidad de cuidados intensivos y 576 personas estaban en ventiladores. Hay evidencia que el orden de quedarse en casa está funcionando. Es la verdad que todavía estamos viendo casos y desafortunadamente la gente sigue muriendo. Pero imagine que la cantidad de casos y muertes si no hubiéramos implementado una orden de quedarse en casa. Veremos cientos, muchos más casos y muchos miles de muertes. A medida que avanzamos para reabrir, debemos hacerlo de manera segura y deliberada. La decisión de cambiar nuestras vidas no era fácil. Agradezco al gobernador Pritzker por haber decidido firmemente proteger a toda la gente de Illinois por la orden Stay at Home en marzo. Si no se comprometió con nuestra seguridad tan pronto, Illinois no estaría listo para pasar a la fase 3 del plan Restaurar Illinois en unos días. Por favor, escúchame. El virus todavía está presente en nuestras comunidades. Quedando en casa cuando puedan y practicando distanciamiento físico continuará ayudando a detener la propagación de este virus. Imagine fichas de dominó alineadas. Si tumbas el primer dominó, el resto caerá. Sin embargo, si saca una o dos fichas de dominó de la línea, o si las espacia más y tira la primera ficha, el resto de la línea no caerá, porque no hay un dominó para caer. Por favor, debemos continuar siguiendo los datos, lo que ayudará a informar cómo avanzamos y cómo podría ser la nueva normalidad. No deshaga todo lo que hemos hecho y corra el riesgo de regresar. Por favor, hablan con sus familias, sus amigos, sus vecinos, sus comunidades sobre la importancia de seguir adelante en nuestra lucha contra COVID-19. Muchísimas gracias. And with that, I'll turn it back over to Governor Pritzker.
Thank you very much, Dr. Ezike. I want to begin my portion of today's briefing with some, frankly, very exciting news. Over the last few weeks, we've seen Illinois make significant measurable progress, and I've been reporting on it to you, in growing our daily testing numbers. And today, we reached another major milestone. Among the most populous states in the United States, Illinois has now overtaken New York to become the #1 state in the nation for testing per capita over the past 7 days. There's much more work to do to advance testing to make it even more widely available, but I do want to recognize at this juncture the folks who made this happen. Of course, IDPH and its lab professionals who are working day and night to process the tests that are given to them. Our raw materials procurement teams, our in-state research university partners, our partner hospitals, health centers, and clinics who are administering the swabs and tests, commercial laboratories, the Illinois National Guard, and of course, the countless healthcare workers doing the patient care right there on the ground. And I'll take this moment to remind everyone who can get a free test at any of our COVID testing locations. Anyone who has COVID-19 symptoms, a cough, shortness of breath, a fever, for example. Anyone who has a risk factor, such as a contact with someone confirmed to have COVID-19, or a compromised immune system, or a serious chronic medical condition. Anyone who works in a healthcare facility. Anyone who works in correctional facilities, such as jails or prisons. Anyone who works as a government employee at any level of government. Anyone who serves as a first responder, such as a paramedic or emergency medical technician, a law enforcement officer or a firefighter. Anyone who supports critical infrastructure, such as workers in grocery stores and pharmacies and restaurants and gas stations and public utilities, factories, childcare, and sanitation. As testing expands, so too will the criteria allowing more people to get a test. A full list of our more than 250 public testing sites is available on our website at coronavirus.illinois.gov. I also want to update you by letting you know that all 4 regions of the state of Illinois remain on track to meet the metrics to move into phase 3 of Restore Illinois. That's terrific news. Phase 2 of the plan began 18 days ago on May 1st with the reopening of state parks, golf and other outdoor recreation facilities, the opening of garden centers, pickup shopping options at retail stores, the beginning of schools allowing students back in to retrieve personal belongings, and some additional sectors of manufacturing returning to work. And of course, it's been in phase 2 that non-emergency surgeries restarted, which included everything from biopsies to chronic pain procedures to orthopedic surgeries. These reopenings happened for all of Illinois over 2 weeks ago, and they're only now coming to some other states, like in New York, in New Jersey, and California, where curbside pickup at retailers only became available in just the last few days, or golf in Massachusetts, which opened about a week after Illinois. I know that monitoring the various measurements, rules, and regulations across the United States is hard to do, especially if you live in a border city and you see a lower level of precaution just down the road. Believe me, I wish there wasn't such a patchwork of different requirements from state to state. There should have been a national plan. In fact, there was real potential for one. In mid-April, the president unveiled the White House guidance for reopening with explicit public health factors weighed in the mix. Under the president's own plan, Illinois would not reach the next phase until after our current Illinois plan has begun phase 3. But President Trump decided to inject politics in where science and data should have won out, leaving the states to create the patchwork that exists today. Some states have chosen not to listen to the advice of medical experts. There are even politicians in Illinois who ignore science and instead are playing to a small minority who protest at our state capitol. Most of the states with the largest economies have chosen to listen to the science and analyze the data and act according to what will restart jobs and businesses safely. I can say with confidence that here in Illinois, we've committed to operating with a focus on public health and transparent, measurable benchmarks to move to each new phase. For those interested in seeing the data and the metrics, They're updated each afternoon and posted online at dph.illinois.gov/restore. Joining us today are two experts in infectious disease control to provide their perspectives. Dr. Richard Novak, head of the Division of Infectious Diseases at the University of Illinois Health System, and Dr. Emily Landon, the Executive Medical Director for Infection Prevention and Control at University of Chicago Medicine, who first joined us in March and inspired so many Illinoisans to help keep each other safe. These two doctors have graciously offered their time to update you on the battle against COVID-19, which is still very much alive in the halls of our hospitals and among the population at large. Before I turn the mic over to them, I want to say that I know there are some of our fellow Illinoisans who feel that their lives didn't change much between phase 1 and phase 2, and we're all itching to move ahead. So why can't we just do it now? Well, there's no doubt this is hard. But public health means that each of us is working to protect all of us. It's about our collective impact on each other. And because many Illinoisans are engaged with the reopenings that have occurred in phase 2, it's critical that we observe the full 28-day measurement period before moving forward to phase 3. The good news is that we're just 10 days from that point. And as of now, all 4 regions of Illinois are on track and moving forward into phase 3 before the end of May. As residents, businesses, and employees gear up for phase 3, we will be providing specific safety and mitigation guidelines for workplaces and activities that are reopening. These guidelines have been in development with business owners, employee representatives, and industry associations, including many women and minority-owned operations. And I look forward to sharing more information about that in the coming days. Until then, I'm delighted to hand this conversation over to Dr. Emily Landon, Executive Medical Director for Infection Prevention and Control at University of Chicago Medicine. Doctor?
Thank you, Governor Pritzker, for inviting me to join you today. First of all, I want to thank all of you Illinoisans for being sensible, cautious, and selfless in the way that you've approached this pandemic. Some of you have been sick. Some of you have lost loved ones, and many of you have lost jobs. But I know a lot of you will also look back on this and wonder why we had to stay at home since nothing awful happened. But like I said in March, this exactly is the mark of success. It's what a flat curve looks like. It's not perfect. Still, every person with COVID passes it along to someone else who will get COVID. That means our case counts and hospital loads stay stable and somewhat predictable. We would love even less transmission, but this virus is tricky. And even keeping things flat has required huge sacrifices. Now we all realize there will be no swift rescue, no knight in shining armor in the form of a vaccine or an antiviral that will sweep in and return our lives to normal before the summer comes. I'm pretty disappointed about not looking forward to sitting by a pool or going to block parties and taking a vacation. But we need to begin to revive some of our workplaces. And it's not without risk that we do this. Our transmission balance is tenuous, and business as usual could set off another wave of infections that threaten our lives and our livelihoods. We need masks, we need hand hygiene, and we need distance to make this work. And we do need to be all in order to be successful. These cloth masks, like the one I have here, are our lifeline. As you know, people can spread COVID for days before they get sick, or some people may never get symptoms at all, which means that anyone could be contagious with COVID at any time. And these cloth masks don't just help protect you from other people who may be sick, which it turns out some new evidence shows they may be better than we thought they were, which is great news. But they also help to keep your own respiratory droplets inside the mask so that you can't get them onto grocery store boxes or ATM screens. But they're not perfect. and you can't wear them when you're eating and drinking. And that means we have to pair them with keeping our distance and staying home when we can, and keeping our hands clean in order to maintain that tenuous transmission balance that we have. So please, never leave the house without your face covering. And always put it on when you go inside another building or if you're near other people outside. Soon, I promise, it will be as natural as wearing pants, which most of us are pretty good about. I still see a lot of people, though, that don't have face coverings on outside. And it makes me wonder if we're going to be as successful in this next phase as we have been in March and April. I think we can do it. This is a fight against a virus, not an ideology. And I know many of you understand that. A lot of you, almost all of you. And you will take my message to heart. And you'll lead your families, your communities, your neighborhoods in wearing your masks, in staying home when you don't need to be out, in order to make space for essential workers, to be able to get to their essential jobs, and for other people to do important tasks. And when you do go out, you'll wear your mask proudly, because it says to others that you're not giving up, and you're not giving in, because you're in this fight to win.
Thank you very much, Dr. Landon. Terrific, and just a message that I know people will take to heart. So very much appreciate your time and willingness to share. I next would like to introduce Dr. Richard Novak, the head of the Division of Infectious Diseases at the University of Illinois Health System. Dr. Novak?
Thank you very much, Governor. I'm very pleased to participate in this conference today to give you both clinical and research perspectives on facing the challenge of the COVID-19 pandemic. Illinois is meeting its goals of expanding the availability and numbers of COVID-19 tests, and the percentage of positive tests is steadily declining, as you pointed out earlier. In the hospital setting, this is reflected by a slow but measurable decline in new hospitalizations and fewer patients in intensive care, as we're seeing at the University of Illinois. The flattening of the curve has prevented the healthcare system from being overwhelmed, and the death rate per capita here in Illinois was much lower than in other states like New York, despite the number of cases that we've seen. This is all a result of these careful measures that we've been taking. We're now receiving shipments of the drug remdesivir, which has been proven to be effective at reducing the severity of the illness, and particularly if it's given before the severity of the illness gets worse. We're not done with this, however. We've launched next phase study combining both remdesivir with a second drug called baricitinib in hopes of further improving on the outcomes of people that we treat. By all measures, it appears we're making slow but steady progress in controlling the pandemic here in Illinois. This has been through careful examination of and response to the data. I know people are tired of wearing masks and social distancing, as Dr. Landon pointed out. You may ask, why do we still have to do this? Masks are very effective at capturing the droplets with virus in them. Surgical masks are maybe a little bit more effective than the homemade mask, but they both work. We call this source control. You're the source, and your droplets are being captured in your mask. South Korea was able to very rapidly control their local epidemic by universal masking, social distancing, and large-scale testing, just as we're doing here, and we're seeing the effect of those measures. As society begins to open up in the coming weeks, we'll need to continue practicing social distancing and wearing masks. I really like the analogy that Dr. Ezike did with the dominoes. We do these things because it protects those around us. We're all in this together, and I wear a mask so that I won't spread the virus to you. You then won't spread it to your family and friends. In turn, I hope that you will do the same for me, and eventually this pandemic will fade to the point where we won't need to do it anymore. We're not there yet. Lastly, the search for new treatments and prevention strategies is moving at an unprecedented rate. Vaccine trials will be starting this summer here in Illinois and elsewhere. I encourage everyone to volunteer and participate in these important studies. The whole world is waiting for the results of these trials. I'm going to don my mask and turn it back over to you, Governor. Go Cubbies.
Go Cubbies. There you go. Go Cubbies. Terrific. Thank you very much, Dr. Novak. And now I'd be happy to take any questions from members of the media, and perhaps the doctors who've joined us might be willing to take questions as well.
We're going to start with online questions today, and then we'll move to our pool reporters, and we'll try to keep it tight here and even between all three of us. So we will start with Christine Herman at NPR. Can Dr. Ezike please elaborate on what exactly it means that Phase 3 will allow limited childcare and summer programs open with IDPH approved safety guidance? Has that guidance been made available yet?
Yeah, so we will have more information to come before the end of the week, but we know there are childcare establishments that are already open now, and we will continue to make that available as more and more people will be returning to work. So obviously that need is pressing, and more pressing as people are getting ready to return to work. So we will lay out that guidance in just a few days, and we will have more childcare opportunities to address the needs of the communities as they start returning to work.
Jerry Nowicki at Capital News Illinois. The hospitalization numbers all appear to be the lowest since you began reporting daily data on April 12th by a considerable amount. Should we take anything from this, or are we still expecting more volatility in those metrics?
I think I'd like to call on any one of the three doctors, honestly, to answer that question, but perhaps we'll start with Dr. Ezike, and please chime in, anybody else.
Yeah. So I get it is great news, and I'm glad that you noticed that to fall under the 4,000 for the number of people hospitalized. So obviously it's a continuum. People get infected, then they get sick, then if they get hospitalized, then the ICUs and maybe pass on. So it is a good sign that there's fewer people in the hospital, but we have to remember that things are going to start changing. And so we will continue to follow these numbers. And it's why that we need a hard reset and can't just jump from Phase 2 to Phase 4, because with each phase, we've made changes and loosening things up. And so we want to make sure that these new things that are coming on board, that they are not resulting in another new acute spike or increase. And so that's why we will continue to watch closely, and over the next phase, another 28 days, make sure that these measures that have loosened don't have a spike that will make us want to tamp the brakes a little bit. So we'll be watching that closely, but yes, this is good news. This just solidifies these measures have been working, both the stay at home, both the masking, both the social distancing, all of those things are effective, and that's why we've got numbers that are improving.
If you don't mind, I just want to, Dr. Ezike obviously has said everything important that there is to say about this, but I would just add that the volatility in these numbers is up to us. It's whatever we make it, with the way that we take on and adapt to the changes that we have to make in order to accommodate this virus in our daily lives. So I hope, and I know Illinois can do it.
Hannah, the Dateline. Governor, lawmakers will return to Springfield this week and vote on a budget based on revenue estimates from Gombe and COGFA that are now about a month old. Are there updated revenue estimates available from your office, and are you asking lawmakers for a lump sum budget in order to make cuts and spending decisions yourself? If so, what can be cut?
The answer to the latter question is no. The answer to the former question is that there have been some adjustments, not major revenue adjustments, but as I mentioned the other day, there's additional spending required related to Medicaid. Now, we believe that that some of the federal funding that will come will alleviate a little bit of that, but to be honest with you, we're including it in the budget because we don't know. And so that additional spending will have to be in the budget, and therefore, we're going to have to make room for it because we have to cover healthcare, especially for COVID.
Chris Carter, WAND News in Decatur. Several malls and businesses are set to open next week. What resources, aside from guidance, is the state offering them, financial, etc., to reopen and ensure public safety?
We're simply providing guidance, and of course, they can get individualized guidance if they need to with IDPH. But we've basically set out, a set of safety rules for them to follow, as we have for a number of industries. We'll be rolling that out over the next coming days.
Janice in Peoria, from the ABC affiliate there. Many Illinoisans are asking for more recovery information. Can you tell us what you know about recovery data and the challenges involved with trying to collect it?
Maybe Dr. ZK could answer that for us.
Yeah, so I guess, some of the interaction with the patients kind of falls off once they're not in the hospital. And obviously there's a good outcome if they haven't, succumbed to the disease. So we can deduce a lot of recovery data in terms of just seeing people who are not in the hospital and obviously subtracting the people who have unfortunately succumbed to the disease. But in terms of actually talking to all the people, it's just been, a challenge for the teams and the staff who are so busy with the response. But we are trying to get as much information for you. We're definitely going to see how we can put that information on the website going forward. We have been very diligent about doing these email surveys followed up with telephone surveys where we were talking to people 14 days after a positive test, 21 days, and 28 days. And we have consistently seen that 70 to 74% of individuals after 28 days following their positive tests have reported that they were fully recovered. So we know